wellness revolution starts now.
Hello, I'm Dr. Steve Hotze. Welcome to today's program. I want to share with you about parasitic diseases. Parasites are a much more common problem than people realize. Very few physicians were ever instructed on parasites during medical school. The last course I had on parasites was my last semester in college. I took a course on parasitology, and I can't remember in medical school ever being taught anything about parasites. I know it's something that very few doctors even consider. Now, parasites are organisms that live on a host or in a host, and they derive their nutrition from the host. There are three specific types of parasites. There are protozoan parasites, single cell parasites. There are worms called helminths, and there are ectoparasites. Now, and they can all lead to chronic diseases. How do you get parasites? Well, you get parasites, you travel to a foreign country, it's not uncommon for people to develop some type of parasitic infection. I remember in my practice of emergency medicine, which goes back into the 1970s and 80s, here in Houston, I saw two different cases at two different locations of young individuals, young men that came in that had been out of the country. They had been to Africa, and they came back, and they were having intermittent fever. And for some reason, I thought to myself, I wonder if they couldn't have malaria. Sure enough, I did a blood smear, and I saw malaria parasites, and they were treated for malaria, and they got cured. So it's people that travel to foreign countries can get parasites in the country, whether they're simply protozoa from food or poor sanitation in the country in which they're in, or getting bit by a mosquito that gives them malaria. You can also get parasites from pets. Most common pet that causes parasites are cats, and it's the cat litter that contains the eggs of Toxoplasmosis that will give you a parasitic infection. You can also have an infection by being exposed or consuming undercooked meat, and that would be beef and fishes or pork, as well as exposure to contaminated water. So let's just talk about a few of these. First, protozoa infections. You have Toxoplasmosis or Toxoplasma, and that commonly occurs from cat litter. Cats have toxoplasma in their system, and they excrete their eggs. And when you clean up the litter, if you're not careful, you can get it on your hands and in some way touch your mouth, and next thing you know, you've got toxoplasma in your system, and they lay eggs in your system, and they may or may not present with problems. The common problems that we see with parasites that people have are abdominal pain and discomfort, bloating, diarrhea, nausea, vomiting, fatigue, weakness, joint and muscle aches and pains. They can develop anemia. They can have skin rashes, chronic headaches, mood swings, depressions, allergic reactions. All these problems can be caused by parasites. And routinely, you go to the physician, and he's not thinking about parasites, so he's treating you for irritable bowel syndrome. And you're not really treating the underlying problem, you're treating the symptom of the underlying problem. So with protozoa infections, you get the most common are toxoplasma, which comes from cat litter. It also comes from undercooked meat. You can get giardia, which comes from contaminated water. And that can cause these same problems that I just discussed. Another common infection is sexually transmitted is trichomonas infections that are transmitted sexually. People in other countries beside the United States that have mosquitoes that carry malaria develop malaria infections. And malaria kills about 600,000 people every year worldwide. The other type of and those are single cell organisms. The other type of infections that we see from parasites are the worm infections. They're called helminths, and those would be the roundworm, the pinworms, tapeworms, hookworms, whipworms, and flukes. And these can be commonly caught through eating undercooked meat or fish. People that eat sushi or they eat undercooked meat, whether it's beef or pork, can get the eggs into their system, and those eggs then reside in the intestines and they make worms. And people that have different types of worms have worms. I've had patients that I know, guests that I know, that have excreted worms 2 and 3 feet long when they got on a treatment for parasites, which is really kind of frightening to think about that, because most patients are never treated for parasites because most doctors never think about the parasites. The other type of parasites that we see commonly are, and by the way, I do want to go back to the fluke, which is schistosoma. Those parasites can reside within the bladder and cause squamous cell cancer of the bladder, and they can also reside in the colon and cause colon cancer. Schistosoma also can cause liver cancer and cancer of the gallbladder ducts. So, and how does this happen? How would parasites cause cancer? Well, they cause chronic inflammation. They affect the energy production in the normal cells, and the cells begin to deteriorate. This affects the DNA, and it's ripe for the cells then to transform and turn into cancer. So this is one of the way over time. It doesn't happen overnight. Doesn't mean anytime you get a parasitic infection, you're going to get cancer, but there's been a correlation between specific parasites and certain types of cancers that develop. That's why, interestingly enough, there are many alternative physicians and alternative cancer doctors that use ivermectin, which is an anti-parasitic, and menbendazole, which are natural anti-parasitics in the treatment of cancer. And it's thought that the reason that these may be effective is they may be killing the parasites that have embedded themselves in the tissue of maybe the colon or in other organs of the body, causing the inflammation that's leading to the cancer. And by killing the parasites, you're relieving that chronic inflammation and enabling the body to heal itself. So it's interesting that it's really over the last several years that we've seen the treatment of using these repurposed anti-parasitic drugs in the treatment of cancer with success in many cases. So I know a number of different individuals that have had cancer that have used these medications and have been cured. Doesn't mean everybody's going to get cured by using these medications, but it simply raises the hypothesis that parasites may be one of the mechanisms that leads to cancer development in individuals. So again, if you have a chronic disease, chronic skin condition, if you have chronic abdominal problems that's not corrected by medical treatment, you need to think of the possibility that you could have parasites. Now, how would you diagnose it if you had parasites? Well, you can do stool tests. And stool tests can measure and see if you have any parasitic eggs in the stool. The problem is that the eggs aren't always excreted timely, and so you may have several stool specimens that prove negative. Doesn't mean you don't have parasites, they just weren't diagnosed. You can also do some additional blood testing to see if you have antibodies to parasites, which may show that the blood testing may mean you had parasites in the past, don't have them now, or you may currently have them. But if you have these symptoms that are not resolved by maybe a yeast-free eating program and cutting out the carbs and eating a ketogenic diet, or they're not not being resolved by any medication, you need to consider consulting with physicians that at least are thinking about the possibility of parasites. Now, I did wanted to mention one other type of parasite, and that's the ectoparasites. That's like fleas and lice and ticks. Ticks can give you Lyme disease. Mosquitoes, which are an ectoparasite and feed off your blood, they can give you malaria. So, and if you have lice, of course, all these things can be treated topically, but they can lead to skin disorders, and of course, they can lead to some severe parasitic infections like malaria as well. How do you treat these infections? Well, if they're worms, you can use ivermectin or mebendazole. So in individuals that have potential or diagnosed parasitic infections, we use ivermectin and we use mebendazole. And those are important. And these are for the worms primarily. If you have a protozoa infection like Giardia, which you get from contaminated water, like you're out in a lake swimming and it gets in your mouth, and the next thing you know, you've got diarrhea, or you go to Mexico maybe and you're eating the wrong kind of food. Maybe you got Giardia, and that can be diagnosed by stool and by blood tests. You treat that with Flagyl, and that can eliminate the protozoa infections. So at all times, you want to consider the possibility that you may have contracted or may have an underlying parasitic infection that's gone undiagnosed. How many Americans have parasitic infections? Well, according to studies, it may be up to 25% of the population have been infected at one time or currently infected with parasitic infections. Most of us think it's third world countries, but it's not. It can happen here. And it often has to do with poor sanitation. And again, I'll remind you, on the cats, people that have cats, be very careful in the cleaning out of your cat litter. I'd recommend using gloves to do that, or make sure you wash your hands very well and don't touch it to your face or the rest of your skin. You don't want to develop toxoplasmosis from that, because that can lead to some severe adverse chronic illnesses. So the long and short of this message is parasitic diseases exist in America. They largely go undiagnosed because very few doctors ever consider them in their differential diagnosis. They should be considered if you have chronic problems that are unresolved by the treatment some physician has you on. You can test for it. Tests aren't always positive, and so it doesn't hurt to do a empirical course of ivermectin or mebendazole. There's also some parasitic cleanses. There are some natural approaches with botanicals that can be used as well. We use and recommend a company called Cellcore that has a parasitic cleanse, which I frankly am using empirically myself, just because I talked to an individual that I knew that lives, it's not one of our guests, but we had met her in the past, and she was doing a parasitic cleanse because she had cancer, and the doctor she saw for her breast cancer requires all of his patients to do a parasite cleanse from a company called Cellcore. And she wrote me and said, "Doctor, I can't believe this, but over the last 3 weeks, I passed worms as long as a foot long in my stool. I can't believe these critters were in my body." So that made me think of what we've been talking about, the unrecognized infection of parasitic infections, parasites in individuals that go undiagnosed. So I hope this will give you another way to approach your chronic illnesses and make sure that you're evaluated for the potential that you could have a parasitic infection. If you want further information about this, don't hesitate to give us a call here at the Hotze Health and Wellness Center. We'd be glad to evaluate you and see if we can't get you on a path of health and wellness naturally, whether or not you have parasitic infections or not. But we'd be willing to look at that and consider that as a possibility. But we want you to be able to have energy, vitality, and enthusiasm for life. We want you to increase your health span living longer and living well longer. And parasites can adversely affect your health span. I'm Dr. Hotze. Thank you for joining us today.
At Physicians Preference Pharmacy, we specialize in compounding bioidentical hormones, which means that all of our hormone medications are made right here on site in our compounding labs. The term bioidentical means that the hormones in the products that you're taking, whether that's in a capsule, a tablet, or a cream form, are chemically identical to those which your body produces. So your body responds the same way it would to its own hormones. This is important because hormones work in the body as a lock and key system. Just like your front door, only one shape of a key will fit the way it should to unlock that door. And the same goes for how hormones work within your body. For a medication to be the most effective, with the least number of side effects, we must give your body something that it recognizes as its own. And this is why we choose bioidentical.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.